Staying healthy today, a Consumer Reports investigation is raising questions about cancer screening. The group's investigation suggests that some people are getting tests they really don't need or understand, and that too few are getting those that could save their lives. The Consumer Reports study finds 3 tests are most effective. They are cervical, colon, and breast cancer screenings, while other tests for bladder, lung, and prostate, as well as skin cancers, may not be as necessary unless you are in a high-risk group for those particular diseases. Of course, consult your doctor with any questions and concerns about cancer screenings. Now, a new study in the journal Alcoholism suggests diet soda mixed with alcohol makes your drink more potent. People who drank diet soda with vodka had a higher blood alcohol content by as much as 18%. The reason? Scientists think that sugar reduces the absorption of alcohol in the intestines, so diet beverages with no sugar make for increased alcohol absorption. February is Heart Health Month, and here's something that you might find pretty surprising. More and more women die of heart disease than of all cancers combined, and more than 500,000 people die each year in the U.S. Dr. Dianne McCallister is the Chief Medical Officer at Centura's Porter Adventist Hospital. She's here to talk to us about heart health. Do you find it surprising at all, Dianne, that heart disease kills more people than cancer?
Well, actually, no. The statistics in the United States have been for quite a while that the #1 cause of death in women and men is heart disease.
Now, what has brought down the numbers? The deaths are down over the last decade. Is there anything that you can point to or that researchers can tell us about?
Yes, we've seen a 21% decrease in women dying each year from heart disease. And there's 3 things that contribute to this. One is education. We've done a lot of education over the last 10 years to help people become aware of heart disease and the symptoms. Secondly, lipid-lowering drugs, the statins, have dramatically improved cholesterol and then prevented heart disease. And finally, we have much better interventions when someone's having a heart attack. The ambulance brings them in, and within 90 minutes, they get their blood vessel opened, thus reperfusing the heart and helping prevent heart damage.
Oh, we've made such strides in that kind of acute care.
Yes.
Let's talk about better diet and exercise. So many people are preaching that. We hear that over and over again. They help the heart, but there are many things that we can do, other things besides good diet and exercise.
Absolutely. While diet and exercise are important, stress is an important part of heart disease. So anything you can do to reduce your stress will help lower your risk of heart disease. A new article showed that doing yoga decreases risk. Also, getting enough sleep. As we've talked about before, 8 hours of sleep helps you. The interesting thing is too little sleep and too much sleep both increase your risk. And then having positive relationships. There's a lot of literature that shows that people who have friends, family, and even pets have lower risks of heart disease, probably again related to stress. Then there's some new studies that show that people who sit a lot have increased risks of heart disease, and just getting up for like 3 or 4 minutes an hour helps reduce the risk. Salt is hidden in a lot of foods, and so you want to decrease salt. But the good news with Valentine's Day coming up is dark chocolate is good for your heart, so eat the dark chocolate. And then finally, go talk to your physician. There's a lot of other risk factors, and you need to make a plan for what tests you need to have to assess your heart disease risk.
Well, this is a reality check for a lot of us.
Yes.
Let's go over those symptoms again while people are watching and are tuned into this.
So the symptoms of heart disease include chest pain on the left side, a heavy feeling in the chest, pain in the left arm, pain in the back, and then a lot of women just get a feeling of fatigue and very unusual fatigue. If you have those symptoms, you need to call the ambulance and get in and have an intervention. We'd rather see you and decide it's not heart disease than have you stay home and we could have opened your heart vessels.
And saved your life.
Exactly.
Wonderful advice. Thank you so much,
You're
Dr.
welcome.
Dianne McCallister. And we are going to put this information on our website, and I'll have it on my Facebook page as well. So for those of you who missed it, don't despair. Later today on Denver 7, using a hormone produced during pregnancy to try to lose weight. Dr. Oz re-examines the HCZ shot and if it's right for you.
Advocates say HCG helps to suppress your hunger and trigger your body to burn fat, not muscle. Some argue the weight loss is strictly due to the dramatically limited diet of 500 calories a day.
We've tackled this topic before, but now I am challenging our experts to give us the latest research on HCG. We're going to hear the debate on both sides, including a doctor who's convinced it works, and she says she has proof. Plus, I'm talking to real women who say not only did they lose weight, but they've been able to keep the weight off. Could this shot work for you?
More on this controversial shot for weight loss today at 4. Then stay tuned for the latest news and weather on 7 News at 5.